to speak a little bit more about this document. I just want to say, I just want to add to this introduction a little bit of context. We're facing a year where most of the countries will be focusing their energies in developing this fundings initiative, which is called in the World Fund Interventions Cycle 7. So at least we know that 6 countries have prepared to submit their requests for Windows 1, and some other countries are running right now to submit their request, funding request for Windows 2, which will be delivered by the end of this month. So throughout these experiences on giving this support, remember that one of the functions of the platform is to provide this technical assistance in order to improve the community participation within all the processes of preparation of these requests. So we're working coordinated together with ICASO so we can develop these collaborations and they can create these synergies at the moment of providing this support to these communities. And we have seen that there are some key factors that should be analyzed in detail. And one of these key aspects is how to prioritize. And it is not only a process on saying what is it that we would like to show in this fundraising request. We also believe that this is a very reflective process, as Karen just said, where several aspects need to be considered within the context. So that's the reason why we ask Joan to helping us on developing this tool. This is a guideline for you at the moment that you need to sit and at the moment that you need to develop, or how is it that you are going to set these priorities that these new modalities are requesting from the Global Fund. So I just wanted to give this context so we know exactly where we are and why is it that we're doing this job. And I think that this is enough, so we can give now the floor to Joan, and then he can explain to us exactly what is this proposal about. So thank you so much for being today, this morning with us. Thank you so much, Anwar. Thank you so much, everyone, for this, for being together today in this session. Thank you, everyone. My name is Joan Tallada. I'm a counselor, consultant. I live on a regular basis in Barcelona, Spain, but I also work a lot with Latin America and the Caribbean around the world. My biggest experience is with the region of Latin America and the Caribbean, basically with HIV, but also I have worked with TB and malaria. So what I will show you today, it is a reflection work, and it has its origin in a presentation that was taken place in the Latin American Forum of Lima by the end of last year, where several of these ideas were presented thanks to the discussion that was held in that forum. So we just continue feeding these ideas, and now that is how this project was developed, on how to create this document. Therefore, what I'm going to show you today is the outcome of that forum, of that discussion. I do not pretend to be that person that is exclusively the originator of these ideas. I think that the dialogue with all of you, this dialogue held with all of you, and also with all those leaders at that moment, are facilitating and are enriching also these ideas. So what I will show you today is those basic lines that this document is there in the internet. I just want to give a short presentation because I would like to focus more in the discussion aspect. I would like to exchange ideas, to clarify doubts, and also listen to your experiences, and also the vision that you have about these ideas, and if they are interested or not, or if we should include some other aspects that maybe we haven't considered yet. So at the end of the
Decides
day,
tú
this
tampoco.
only has
Entonces,
makes sense if
digamos, elucubraciones
all these
o todas
ideas
estas reflexiones
and all these reflections
tienen sentido
have sense if
si
at the end
ustedes que prestan servicios
you
a
who
la
offered those services to the community
a las
and
personas
you
que están
want
afectadas por las enfermedades
that those that are affected by these diseases
vivan más tiempo
live
en
longer and
beneficio
with better
de la
quality of life. And if this is an opportunity,
enfermedades
and
que ya
once if they have this
con
disease,
las bebidas, sobre
they
todo
can
con la
live,
malaria, pueden
or in case
curar.
of if they have with
Se
malaria or
pretende
TB,
cuidar
they
y
can
la idea es
get
poder
cured. So the
ofrecer
objective is that at the
a
end,
las
that we
poblaciones
can serve those populations that we are giving these,
cuya existencia son nuestra razón
which our existence is our
no
being, our
estos son
purpose.
reflexiones,
So,
por lo
as Karen was
tanto,
saying, this is just a reflections and not just
de ninguna
perspective.
manera
Yes,
para decirles
in any
cómo
sense,
deben hacer las
this is
cosas.
not a way for you to tell you how to think. These are just elements that want to create this discussion and that invite you to think and to reflect on several ideas on how we can materialize and how we can do these participations needed by the communities. And these are just key aspects or some elements. So we can make solid the position that we are facing with funders or with donors and mainly with the global. So let's start with one open question. I always like to ask this question where
Si fuéramos a un programa de
if let's
televisión
say that if we were to a TV
ustedes
show or if we run a survey, a TikTok survey, and if we ask people, you believe that spending more money in health services will always translate into more health for people?
encontraríamos muchos tipos de
So then we will
respuestas.
find many answers, many responses. Spontaneously, people think that they do, that they will be investing more money, assumes that there will be more health for people. And there are some others that say no, that doesn't happen that way. But then, in order to answer to this question, what it is useful is to see statistics and data. So here we have a graphic in English, but I think that it is pretty understandable. And it speaks about life expectancy against the health expenditure. So we can see that in the vertical line, we have the life expectancy that it reaches up to 84, 84 years. And then the health expenditure for this period reaches 2018. It reaches the $10,000 per capita. When we mean per capita, that means per person. So this health expenditure divided by the number of inhabitants of the country. So what can we see in this graph? We can see that there is one country, and this is the USA, that expends more in health issues. In 2018, it reaches this amount of dollars per year. However, the life expectancy, the average is lower to other countries that spend less of that amount. So let me give the example of Spain that spends $3,000 in 2018, a little bit more than $3,000. This is one third of what the US is spending, and however, the life expectancy of Spain runs between 7 years more than the US. Why this situation? Why this happens? Well, because not always spending more means that we will obtain more health. That's not always a rule. Not always spending more in sanitary services will give you a bigger life expectancy. Depends on how you spend it, but also depends on several other factors. One is the health system itself, which is important. But in many other countries, there are some other elements, such as diet, such as life habits, also the inequality levels with regards of income, people who earns more and people who earns less. So these are these social determinants and cultural determinants also, which have a key factor in life expectancy. But also, when even we
Entonces,
speak about investment,
también depende
specifically in health issues, it depends on how is
Estados
it that
Unidos
you're spending that
invierte
money. In the
muchísimo
USA, they
a
spend money,
tecnología,
they spend in high-tech
a
elements,
tecnología
components, high
en
technology,
industria
very intensive,
tecnológica
high technology, and very
y no
expensive also.
necesariamente te da
That
más
doesn't mean
beneficio
that
en salud.
that will bring more benefits
Am,
in health aspects.
en cambio, en otros países,
On the contrary, in
países
other
de
countries,
España,
as such as the
por
case of
ejemplo,
Spain or other European countries
país
or Canada,
americano,
just to speak from another country of
el
North America,
gasto en salud está
the
mucho más
spends
enfocado
model
en la
with regards of health matters
atención primaria,
is
es
based on
decir,
reinforcing primary health
em,
services. This is a
ya no
public
tan
model and
intensivo
maybe
en el
not
uso de
as
laboratorios
intensive on using high technology that it's available, but it's more equitable. And therefore,
tenemos mejor
the outcome is
salud.
that we have a better life expectancy in those
Vamos a
countries.
ver un poco el
So
ejemplo
let's move on and let's see the example.
de América
Let's see the example
Latina.
of Latin America.
Em, tenemos aquí una
In
serie
this
de
case,
países
we have
en
several
los cuales
countries
podemos ver
where
otra vez el gasto
we
per
can see again
cápita
the income per
y la
capita
esperanza de vida
as
promedio.
well as the
¿Qué
average
ustedes
life
pueden
expectancy.
notar? Pues
What can we
no
notice here?
necesariamente
Well,
siempre hay
not
algo
necessarily it
entre
is
estos.
a correlation
Podemos
between the
comparar
two aspects. We can
Uruguay,
compare here, for
que es
example,
un
Uruguay
país
that spends
$1,660
$1,660
que
per
gasta
person, compared
en
with Colombia that spends
anterior a
less
esa
than
hipótesis,
500.
solo hay un
And
año de
then, so
diferencia.
there's only
Es
one
decir,
year of
Colombia
difference.
gastando
So that means
un
that
tercio de
Colombia
Uruguay
spent it
está
less of
prácticamente
Uruguay.
nivelado
It's almost
en términos de
equal
esperanza de vida.
with regards of the
Am,
average
y
life
eso es algo
expectancy.
que nos dice
So that
la
what does that
cantidad
mean?
de dinero
Well,
que se
that means
invierte
that the
en
amount of
salud
money
se
invested
correlaciona
not always is
con
correlated
los resultados
with
económicos.
the health
Eso
results.
en
So we,
términos de
here it's
esperanza de vida.
shown in life
Ahora,
expectancy outcomes, but we can use some
esto
other
obviamente
indicators. And of course, we will
independientemente
see, depending on that
cosas
indicator,
parecidas.
we will see similar
Pero
cases.
déjenme
But
ampliar un
now
poco el
let me
ejemplo
expand the
y
focus
sobre todo
here. We have
rápidamente los
discussed and
países
we
más
have mentioned
desarrollados.
of these high
Estamos
income
hablando de
countries,
América
and
Latina.
now we're
Vamos
speaking about Latin
a
American countries.
ir
Let's try
a
now
un grupo,
to
digamos,
see
geográficamente más amplio
a more
de países.
broad
Tenemos
geographical region
desde
of
países
the several
emergentes hasta
countries. So we
países
have
desde
countries from
ingresos
low countries to high
medios y también ingresos
income
altos. ¿Y qué podemos observar?
countries. And what can we see
Podemos
here?
observar
We can see
que
here we can see that in
cuando
reality,
el gasto en salud es
when this health spend
cualquier
benefit in
inmediata.
terms of an immediate
Es decir, si
life
tomamos a
expectancy.
países
That is to say, let's say that we consider these blue countries, dotted blue countries,
en este,
in this
perdón, en
graph.
este gráfico intento utilizar el cursor, pero
I'm trying to use my cursor, but I'm not able
en
to
este
do so,
gráfico,
says Joan. But you can see
em,
here in the graph,
los países azules, que
those
son
blue
conocidos,
countries
¿no?
are the ones of low income countries. So as we
Podemos ir
increase
subiendo
the
en la
expenses, we
esperanza de
can
vida,
see that the life
poco a
expectancy
poco
is higher. However,
añadiendo cada vez más dólares
when we are adding more
a
dollars
los
per
presupuestos
capita
ingresos,
per person
empezamos a
in
ver que
this
esta curva
income, we can see that this curve
se hace
tends to be
algo más
flat. It
am,
turns to
está
become,
alcanzando un techo,
or it's
por decirlo
reaching
de
a
alguna
ceiling.
manera.
Just
La curva tiende a hacerse
say
algo
so.
de
This
lo
curve
vertical a
tends
lo
to come
horizontal.
from the vertical to the
¿Esto a qué nos lleva?
horizontal
Bueno,
position. And what does that mean? When we are in this
aumentar el
low
gasto nos va a
scope
dar
of
como
expenses,
consecuencia general
increasing that expenses will give us more
¿no?
health as a general tendency.
Siempre habrá excepciones.
There will be some exceptions, of course. We have this equatorial line and South Africa.
En cambio, cuando
Guinea
invertimos
Equatorial and South Africa are the exceptions. But in this case, we can
imagínate
see
que
that
invertimos $1
more that we
adicional,
invest
tendremos
an additional
un
dollar
punto
to that, we will
menor
have a lower return
de salud, al menos
of health
en
issues,
términos de esperanza de
at
vida.
least in terms of life expectancy. But why is that?
Esto es
Why?
así
Well,
porque existe una
this
ley
happens because there is an
que
economic
regula los
law,
rendimientos de
and we call
crecimiento,
it the law
que de hecho se puede aplicar
of
a
the
muchos
yields.
elementos
And
debo
this
decir
can
que
happen to
no son
several.
buenas diapositivas.
This is the law of
Vamos a
diminishing
esto.
returns. So let's go
En la
back to
ley de
this
los rendimientos decrecientes quiere decir
slide. So this law of diminishing
que
returns means that
cuando nosotros invertimos para
when
obtener
we invest in order
en
to get
cualquier
a
área,
product, to obtain a
desde el
product in any
principio,
area, from the very beginning,
ponemos
when we
esa inversión,
when
esos
we
dólares, esos
invest,
euros, esos
when we put that money,
esos soles,
dollars, euros, soles, pesos,
en ese, en ese mecanismo,
when we that
mecanismo
mechanism, and if that
ya tenemos
mechanism
al
works
principio una
properly, then from the
alta,
very
es decir, por
beginning, we
cada
will have a
dólar
very high
invertido
productivity levels.
tenemos
For per
un
every
inmediato.
dollar
Pero llega un
invested, we will
momento,
have an immediate
llega
return.
un
But
punto
then
en
it
que
gets
los
time
rendimientos empezarán a ser
when these
decrecientes.
returns will be
De manera
diminished
que
in such a
por
way
más y más dinero que yo
that
pueda
giving more
poner
money
con
to that
respecto a lo que
mechanism
estoy
will create
invirtiendo, va a
lower
llegar un
and
punto
reduce the
en que
benefits.
los
But it can
retornos
reach a
sean
point where
negativos. Eso
those
puede, por ejemplo,
returns
puede pasar en
will turn
países muy
negative.
pequeños.
And that can happen in some countries such as the US,
Debido al modelo,
where because of the model that has been followed,
muy orientado a la
because of this private
privatización de
model
los
that it is
proveedores,
followed by
hay una
insurer
tendencia
companies
sobre
and providers, there is a
sobre
tendency on giving that diagnosis on the
que al
excessive
final son
use of
muy perjudiciales
diagnosis techniques that at the end they are more they are worse than giving a better result. They might have also a positive result, but also a negative one.
emplear
So
técnicas de diagnóstico
using
poco
these
necesarias y
diagnosis techniques that are not needed just because they want to
eficientes,
collect money
han
to
de
they
tener
just want to
efectos
charge the
negativos.
patient will have a negative
Las pueden
impact in the
ser
patients because
invasivas,
those techniques can be
pueden ser
invasive. It
endoscopias,
can
otro
be
tipo de
an
intervenciones
endoscopy or some other techniques that are
perjudiciales
truly invasive
para
and
el
that
paciente.
can create a damage
Quedémonos
to the user, in this case the
con esa
patient.
idea.
So
Eh,
what we're
la
trying to say with this
inversión
idea that
al
the
principio es muy
investment
buena
from the very beginning, of
para
course, it will give you good return of investment, but then it turns a point that it diminishes, and if you exceed it, then you can have
¿Por qué todo eso es
a
importante
bad
para las
return. So why
organizaciones que
all
trabajan
of
con
this is
niños y
important for
tuberculosis,
those
malaria,
organizations that work with HIV, TB, and malaria? Let's
luego
take a case, let's take an example as a case. We will speak now from
imaginemos el país
the
X.
HIV perspective. Let's
En el
imagine
país X tenemos
X country, any country,
organización donde
where we have
los
one
que tienen sexo
organization that for those who
tienen
have
VIH,
men who
muchos de
have
ellos
sex with men,
que
some
viven
of
con
them,
VIH
some of this
aquí
population live with HIV, and this is an average or
20.000 HCPs que viven con VIH,
20,000
es decir,
MSM
el
that live with
85% están
HIV,
diagnosticados y por tanto con un
and they had
diagnóstico.
been diagnosed.
De estos,
Out of
seguimos,
them,
bueno, el 91% siguen
91%
tratamiento antirretroviral
are following an
y de estos
IRT treatment,
casi el
and from
95%
them, nearly
Si vemos estos datos,
95% have this
¿cuál es la brecha más
SDL.
relevante
So we can see
por
which is
tanto
the most
otras
relevant and
intervenciones?
where should investment be focused? What would be
Los
the
datos
answer?
nos lo muestran.
Well, based on this
Lo que
data,
vemos es
we
que
can
si
see
conseguimos
that if we
que
are
las personas
able
sean diagnosticadas,
to get that
si
those who are diagnosed,
conseguimos
if that
algunos
15%, if we
diagnosticar,
can diagnose that
luego
15% is missing,
vincularlos y
and then
retenerlos
link them and
en
also keep
tratamiento y
them
conseguir que tengan su
within
tratamiento,
treatment,
no es complicado. Por lo
that
tanto,
seems that it is not
según estos
complicated.
datos,
So according
la
to this
prioridad
data, the
es
priority will
la
be
identificación de
to
casos.
identify those cases.
Porque
So
entonces
then
utilizamos
why
un criterio de
why we
eficiencia para
use
tomar la
this efficiency
decisión
criteria in
de
order to
cuáles
make
son
the
los
decision on
momentos de
which is the best
identificar
moment to identify
nuevos casos.
the
Estamos hablando
the
aquí
cases.
de la eficiencia
So here we're
alópata
speaking
de
about
personas.
this
Es
efficiency,
decir, estamos hablando de
this
distribuir los
allocative
recursos
efficiency.
más
That is to say that
convenientemente
distributing our resources in a
esa es
way
nuestra
that we can
pregunta.
obtain the better
¿Qué queremos
results
aquí?
aligned with our
Que la
goals.
mayoría de
So
personas
what do we want here? We want that
vivientes
most
con
of the
esto
people living with HIV, in this case, the
estén
MSM group,
teniendo su presión
they
baja.
can they can have
Para
their
eso aquí la prioridad
viral
es
load.
invertir
So
más
that is why the priority here is to invest more
Esto no solo
in
es
the case
relevante para
identification. And
la
this is not only
reducción
relevant to
de los
reduce the
casos,
transmission and to
es
improve the health of people living with
también
HIV,
es más coste
but it is
efectivo.
also more
Es
cost
decir,
effective.
cada
That is
dólar
to say that
invertido
every dollar that is being invested in this identification of cases will give us more health results in this chain rather than if we invested in linkage and rotation. And here, linkage and rotation, it's in a higher level. So therefore, if we include here, if we prioritize here, the return will be lower rather than if we place it in the case identification. If we identify those cases, we can link those, and most of them mostly will have their viral load at the end of the period. So that's why this is what we call the allocative efficiency. To recognize in this example, to recognize investing more on identifying the cases that will give us better results. So now let's think in the current model that the country is using. So this is just an hypothesis. This is just an hypothesis based on the experience of what's going on in several countries. Let's say that in the country X, there is a current dual model that is based on the active offer of testing through peers. That is to say, to go to the meeting points, to set tents, and to go and find people through the social media to contact them. And something this is that typically is done by the organizations. So this is the active offer. This is the passive and the active offer. And there's also this passive offer where people can go through public services and they can go and ask to the test. So in this model, in this ex country, this is based in most of the experience of the Latin American countries. So in this case, the diagnostic yield is decreasing. So what does that mean? That fewer and fewer positive cases per 100 MSM tested. So we were find them. So we were able to find two or three. So that means that the yield, what we call this positivity, it's lower. So then what should we do in this case? So one of the things that we can do is to see exactly how can we expand this coverage with all the resources that we have. What can we do so this dual model reaches more people with those resources that we have or that are available or with those resources that we would like to have. That's what we call this efficiency. So in that case, we can see exactly how can we get to those points, where can be, where is it that people are meeting, so we can be more thorough when we look through the social media. So we can try that. However, what experience tells us, and also what this yield theory tells us, of this decreasing yield law tells us, is that we will increase the number of tests, but our diagnosis yield will be reduced more, even further. Why? Well, because we will be trying to expand the number of MSM that are covered, not being clear if what we are looking are those who are really in this risk situation, in a higher risk situation, or those who are having these high risk practices and active risk. So that has happened commonly in the last years. So we have tried to see if by expanding the coverage for MSN who receive their tests, we can have more. And data is telling us that that is not the case. So then, which could be the alternatives to follow? So now let's think about this situation. In this case, about this ex-country, we have spoken that they reach the 85% of MSM who live with HIV that had been diagnosed. So let's think that this population, MSM, is very diverse, not only in this ex-country that we're using as an example, but in any other. So that 85% that we have been able to identify are the ones who are accessible with the model that we have been implemented so far. So this group of people, once that they were to these those meeting places, to the tents, or before COVID to the discos, those are the ones who were accessible and we were able to run the test. But when those meeting points and those social areas we were
Por
able
ejemplo,
to
yo
find the
había
fewer,
conseguido alcanzar
because those who are not
9
accessible are we cannot find them
ok,
through that
ese
model. Why?
15% lo
Because
que
that
me identificaron
15% that
no
remains
solamente
being
tiene las
identifiable not
inconsistencias
necessarily has
por
the
mi
same
testigo físico,
characteristics that the
ya lo
80%, that the
identifiqué.
85% has,
Pueden que
that I
sean
had already
personas
identified. This
que no
could be
vayan a esos
that they are
lugares,
people who don't
que
go
utilicen
to these
otras
places, or that
redes o
they might
métodos de
use some other
socialización,
contact media that I don't have access
sexuales,
to. They might be
hijos y que
men,
a su vez son
children,
trabajadores sexuales, pueden
or
ser quienes se identifican como
they
heterosexuales,
are maybe
pueden
they are
ser
men that I identified
personas
as
con poca
heterosexual, but
formación
they have also a
o
relationship with men, or they might
ingresos
be
a
men that
través
of
del
lower
estándar
income
que yo suelo
to
acceder,
the standard
personas que
to
quizá
which I have access.
trabajan
Maybe
bajo
people that are
condiciones
working all day or all night,
migrantes.
or
Em,
migrants.
las características de
So
estos
these
MSMs seguramente son
characteristics
diferentes de las HCH
might
que hasta
be
ahora he conseguido
different from
identificar.
all the other MS
Em,
with HIV that I had considered.
Consideramos
So
HCH de difícil
we call
acceso, pero para
MSM of
un
difficult
MSM
access, but for me,
no son en sí
in
mismos de
reality, they
difícil
are
acceso,
not of
son de
difficult
difícil acceso
access.
en relación al modelo que estoy siguiendo para poder
They are in
identificar a los
difficult access
datos.
based on the model
Pero
that
si
I'm
hubiera otro
using to reach
modelo,
them. But if
no
there was
necesariamente
another
tiene que
model,
ser
that
de
doesn't mean
difícil
that they will be of difficult
Por
access.
eso se podrían
So
pensar en
that
otros
is why we can
otros
think
modelos
on other
que
models. We
sí me
can think or we
permitirían
can consider on some
usar
other
estos
models that
test
will allow me to reach
con
those
estos
MSM that I haven't been able to
Hay
reach.
muchas ideas,
There are many
publicadas
ideas and there are many
una web
publications of different models from
PEPFAR,
UNAIDS,
habla
PEPFAR.
de varias estrategias
They speak about different
para
strategies
la
that
resolución
can
de
take
HCH en
place
las
so
que
we can find those
por
MSMs that
ejemplo,
as of now we haven't
conocer el
been able to
riesgo
reach.
de los
For
HCH
example, being able to
y
assess
además
the
de un acto
risk
de
of
saber si tiene un
MSM
riesgo sustancial o
if they
doble,
have a substantial risk,
información
and
que
also
pueda
asking for their
garantizar
contacts. So this is
de
what
que
we are
una
doing
persona
in
dé
the
positivo
case
en
that,
esta
let's say, for
evidencia.
example, a person is positive,
La prueba
we
de
ask
los
them
contactos la
to
podemos
give their
hacer
contacts
con
so
una
we can
persona
call
que
the
esté
others,
positivo.
the other
Sabemos que está en prácticas de riesgo porque
that even though they
sabemos que
are
hay riesgo de
having a
exponerse
positive result, they are having
también tiene
risk
prácticas.
practices.
Con lo cual, utilizar esa red de
Therefore,
contactos también es
using
muy
this
útil.
contact network will
De
be also
hecho,
useful.
en el caso de que
In
la persona
fact,
diga que no nos quiere
in case
compartir
this person says that they don't
sus
want to share
contactos o que estamos hablando
their contact
de
list, or that
hasta
their
cierta
contacts, they don't want
proporción
to reach us,
posibilidades
another
de poder estar
possibility
con
then is
para que ellos
to give them self-tests so
esas
they
personas
can
que sabemos que
share with
están
those people that they
expuestas.
know that they
Esos
are
serían otros
facing
modelos
this
que
risk.
podemos
So those are
utilizar.
some other models that can be used.
Ahora bien, a la hora de
Now,
entonces definir
so when we define
eh, esas prioridades y
those
cuáles son el
priorities
costo
and also
para
the
mí como
cost. What is the
organización
cost that it
en
represents
esas
for me as an
prioridades
organization
que
to move forward
eventualmente
with these activities?
va
We
a
need to
tener
consider that that
por
cost
persona, por
will
unidad,
have per person and per
lo que
unity.
llamamos el costo unitario,
Per unit,
va
we
a
will
ser
have
diferente según el
the
modelo
cost will be
utilizado.
different according to the outcome indicator.
Pongamos un ejemplo.
Let's give an example.
Em, seguimos con el país X.
We are still using
Averiguar
this example of this
estamos
country. Let's
hablando
say that this dual
se
model that
cuesta
we've
400 mil
spoken
dólares
about
y que
has a
tenemos una
budget of
evidencia
$400,000, and with that we are able to have
¿Cuál es el
access
costo
to
unitario
50,000
por persona
people. So what's the unit cost of these
Pues
testing units?
$8.
That's $8.
Cada HCH que
Each
alcanzo me cuesta
MSM that I reach
En este
costs
modelo
me
híbrido,
$8.
como
So
es
in
un
this
modelo
innovative model, as this
en
is
el que necesito
a
invertir
model
más
where I needed to
recursos,
invest more resources,
tengo que tener en cuenta
I have to consider
más recursos por persona
more
alcanzada.
resources per
Tengo que ir
people
con cuidado.
reached.
¿Por
So
qué?
I need to be careful in
Una,
that case.
una
Why?
persona que
Well, being able to reach
practica
one person that
sexo
has
con otros hombres, un hombre con
sex
otro hombre, que no se
practices
reconoce como
with other
MSM,
men and they are not
lleva más
recognize
tiempo,
themselves as MSM will
lleva
take
por
longer.
teléfono
It
más
might need
llamadas,
more phone calls.
más
It might need to
desplazamiento.
have more the
Eso
conversations, and it
significa
might need
que puedo
to
necesitar
move
invertir más
more.
recursos,
And that means that I need to
¿no?
invest more, not only human
Esto
resources,
significa
but other
que
type of
tengo
resources also. So that is
un
why
evaluador, que
this
tenemos
example, in this innovative model, we say
$200,000
that we have
para llegar a 10,000.
$200,000 to be able to reach 10,000.
Bueno, porque en realidad llegar a
Because
cada uno de
in reality, being able to reach those MSM that so far I wasn't able to do so, it costs me $20 rather than 8. Okay?
Dices, bueno, esto no tiene
So
mucho
you say,
sentido,
well,
parece,
that doesn't make sense
porque resulta que
because it happens
estoy llegando a menos
that
personas y
I'm
además
reaching less number of people and it is more expensive.
la idea
However,
de este modelo
the
innovador
idea
es
of this innovative model
como que
is that
gracias a este
I
modelo
do believe that thanks to this model, I will
los
be
niveles
able to
que
reach
antes no se podían
positive
alcanzar.
cases that before I wasn't able
Imaginemos que a
to do
través
so.
del nuevo
So
modelo
let's imagine through
y
that
estos
this new
500
model, I'm able to reach
objetivos
a
que tú has
500
compartido,
MSM HIV
los
positive
mismos
that
que
are already identified.
en realidad
Those
estaban
that's the
alcanzando
same
en
number
Estados
that
Unidos.
I was reaching with
Pero
the
aquí
this
estaba
model.
invirtiendo
But in this case, I
$400,000
was
en
investing
pruebas,
400,000
de
in
50,000
five
pruebas,
50,000
mismo para un
tests.
rendimiento de
Out of
1%.
them, 500 positively yield.
Aquí
That
estaba
would give me a
invirtiendo
yield of
200,000
1%.
dólares
And on
para
the other case, in the innovative model, I was investing
en este caso, las
200,000. And
pruebas
in this case,
para los
using
mismos 500,000
10,000
me
tests for
darán
those same 500
5% de
cases
positividad.
reach, and that will
Si yo
give me a
pienso
5% of
cuánto me cuesta
positivity
encontrar
yield.
cada
If I
positivo, no
consider
cuánto
then
me
how long does
cuesta
it take,
cada
not how much
hacer
does it
cada prueba,
take
sino
me
encontrar cada
do
positivo,
the test whenever
digamos, en
a
realidad en el
positive
segundo
person.
modelo
No, but we will see that in this
me
innovative model,
cuesta
in
la
this
mitad
second
de
model,
la
it
anterior.
costs me
Es decir,
half than the previous one.
estoy
So
invirtiendo
I'm
400,000 para
investing
encontrar cada nuevo positivo
400,000 to reach
y
one
perder
new
esos
HIV
100%.
MSN in rather than
Entonces,
800. I'm investing in
en este
400
caso, si nuestro
rather than
objetivo es
800. So
identificar
in this
casos,
case,
el
we are
indicador
able to
comparado
identify it, and
para
the
establecer el costo unitario
indicator
es el número de
for
personas
this
con las que
cost,
se hace la prueba. Si
it's
el
not a number of
indicador
people
de
that were reaching
positivos
to do the
es
test, but a number of
ese es el
positive
costo.
people that I find
En la
thanks to this
segunda
model.
tabla
So in the second
tengo a la
table,
hipótesis, a la
I
siguiente,
have this
que
hypothesis.
los
I
HIV
have this
positivos
hypothesis
no
that the
aumentan,
reach
sino que en el
of
segundo
positive
modelo
people
se
is not the
reducen
same, but the second model,
presumiblemente cero.
presumably,
¿Por
it's
qué? Porque
higher
el modelo innovador
because
es
the idea of the
progresivo.
innovative model is that I'm able to reach
En
more
esto estoy
positive people.
llegando a
So in
otra
this
conclusión,
case,
que estoy
I'm
llegando a
reaching the
700
hypothesis that I'm able
y
to
este es el
have
modelo con el cual mi rendimiento es
700
menos
cases reach, and
7%
in that case, my
la
yield will be
tasa
7%, and the
más
unit
pequeña.
cost per case is even lower.
Es de
It is
286
of
respecto a 800, es
286
la mitad.
compared with 800. It is not half, but it is one
Entonces, ¿por qué
third
no
of that
explotamos
previous
estos
one. So when
créditos
we
o cualquier otro
speak with the
rendimiento
Global Fund or with any other
y los
organization,
presupuestos que
when we
deberíamos de
discuss
utilizar
about the
para
budget
cuántas personas debemos alcanzar
for how many
en
people we want
África,
to reach, let's
no solo
consider that. We need
cuántos
to take that
MSMs
into
vamos a encontrar
consideration.
en
Not only how
diversidad,
many
sino
MSM we're
cuál
going
es
to test,
presumiblemente
but also
el
which
número de
ones,
personas que vamos a
presumably, what is
encontrar
the number of
positivos
positive people
para
that we will be
triunfar
able
en la
to
fase
reach,
uno.
and what is the unit
Luego,
cost per case? Because in the
parece
innovative
todo más
model,
caro,
initially, it seems that it
pero
was
la realidad
expensive,
es
more
mucho más
expensive
barato por el
per
número
tested
de
people, but
MSMs
now you can see
encontrados.
that that's not true.
Algo importante que tenemos que tener en cuenta es
Something
que aquí
important that we need to
pensando
consider is that here we're
en
thinking
sustituir o complementar
on
un modelo
replacing
con
or
otro,
in
¿de
complement
acuerdo?
one model with a
Sin
new one.
embargo,
However,
hay que recordar
we also need to
que la
remember
ley de los rendimientos
that
crecientes se
the
aplican a todos los modelos. Es
decreasing
decir,
yield law
estas
applies
nuevas
to all the
ideas, estas
models.
nuevas
These
intervenciones,
new ideas,
al
these new
principio nos van a dar
interventions
buena
from the very
productividad,
beginning will
pero
give
llegará
us
un
a good
momento
productivity,
en que
but then it will reach a
su
time
rendimiento se
that
desplome.
also their yield will
Con
be
lo cual es
inefficient.
muy importante recordar
Therefore, it is important to remember the
que en el
following.
país X, cuando comencemos
Continuing
a
with this
reducir
example of this country, once that we reach this
los
85% to the
puntos
90% of MSM who live with
el
HIV,
costo
that
unitario de cada punto
the unit
porcentual
cost
de
per
cada
1 percentage point,
en ese porcentaje que queramos
that in that
añadir
percentage that we wanted to add,
indicador
will
determinado,
have a specific
cuando
value.
lleguemos al 90% y
So once
queramos
that we
pasar al
reach that 90%
95%,
and we want
el
to move to the
costo unitario
95%,
es inferior.
the cost per unit
Y
will be
cuando queramos pasar
higher.
del
And when we
95,
wanted to
si es
reach from the
posible,
95 to the
pues es
100%, if
mucho
it's
bueno.
possible,
Y
I doubt that,
podemos
but
intentar
we can try
que el
it.
costo
The
unitario
cost per
sea todavía
unit
superior. Es
will be
decir,
even higher.
ir
So
incrementando
we will be, that is to say
los
that
porcentajes
we increase those
cada punto
percentage
adicional,
every
cada
additional
unidad de
point,
beneficio
every unit of
totalmente, se
benefit that we
apoya
offer, every
para que al
person
final
identified with HIV,
justo
any added person will have a higher
impacto será
cost.
incremental.
The
Es
cost will
importante porque cuando
increasing. So this is important, will be
llega a las fases
incremental because
de
reaching the
negociación,
85
no de
the
negociar,
90 to the 95,
puedes
you should
pensar que es
negotiate. You
durante ese
shouldn't
año,
think that
sino que en el año
this
uno
cost per
hay
unit will be
un
the
costo,
same.
en el
No,
año 2 un
in
costo,
year
en el
one
año
we have one
siguiente
cost,
un costo superior y
and
así
in year two and three we'll have a higher cost
cada una de esas
if you are
fases.
able to reach these goals.
Estos análisis también
So
aplican
this analysis also applies for TB and malaria.
por ejemplo, cuando
For
hablamos
example, when we speak about
la búsqueda de
TB,
síntomas respiratorios y
the search for respiratory symptoms and
por el modelo
identification of
tradicional,
cases following the traditional model with this will be increasingly difficult and more expensive once we reach a percentage of people. Once that we get to that
una persona adicional será más costoso. Lo mismo,
threshold,
pongo el
we
ejemplo de la
will
distribución de redes
see that.
mosquitoriales.
And it is also for the case of malaria with the distribution of mosquito net. We will be able to reach a specific cost per household, and from the very beginning, the unit per cost will be maybe reduced. But once that we reach the 80, 85, 95%, we will need to move forward. We will need to go beyond that. We need to go to places that geographically are difficult to access, climbing mountains or reaching populations that have also more cultural barriers because of language or because of their own culture. So the more that we are saturating the indicator, then it will be more expensive being able to increase this percentage of the goal. So remember that once that you reach this saturation level, we need this innovative model, but this innovative model also that from the very beginning it will be more cost effective, but then it will reach its ceiling. And once that it reaches this stop, this ceiling, each cost will always tend to be incremental. So here it's an example. Let's do a collective exercise. I just wanted to do this, but I think that we are not having much time. So this example is explained in the document. So in this case, this is a service retention example. I don't want to expand because I want to have this discussion. So I kindly invite you to read the document, to see that document and to reflect, to have this reflection. So let's move on to the summary. So in summary, we can say that populations that are difficult to reach are always difficult in relation to the modality that it's used to try to reach them. So we can say in simple words that we don't have these difficult populations, but models that are not able to reach them. So when a modality shows these signs of fatigue, despite of all the efforts to improve it, it is the moment to think to new modalities that complement or that replace it. Because many times when I've been in several countries discussing why this yield on diagnosis for civil society is lower, there is a very defensive attitude on saying that they are just trying who to blame. Let's not find that. Let's not do that. We just need to see that that modality, that model has been really useful as of now, and that has given good results. But that's the time then when we need to think or to consider if we need to replace it, if we need to change that. With regards of the new modalities that will have of whatever is it that we're doing, will have a higher or lower unit cost depending on the result indicator that we're using. Some cases, this indicator will tell us if this unit cost is higher and if it's justified being that expensive. In the example of retention of HIV, it's justified because retaining a person following the treatment, it's more expensive with time. But also, but in the case, for example, of identification, those diagnoses, it might be that is not the case, that the cost per unit is lower. So from a saturation point, and once the most cost-effective innovations have been exhausted, those that may be reached will require more resources, more and more resources. There will be a point where reducing that gap of those percentages that are there will represent more expenses, will be more expensive. So therefore, the unit cost of achieving a specific threshold will be incremental. So this approach, hopefully, it can help you to prioritize your interventions and also to negotiate enough and fair budgets for your services, for the services that we want to be more sustainable. So thank you for your listening.
Gracias, Joan. Ay,
Thank you, Joan.
gracias, Joan.
Thank you.
Miro que ya tenemos algunos
I
comentarios
see that there are some
interesantes,
comments in the chat box
exactamente, de Richard. Y también
from
invito a quienes
Richard.
tengan nuevas
Also, I
preguntas
kindly invite
a
the
levantar su
others
manito o
to
poner
raise your hand or
comentarios en el chat. ¿Sí?
to write your
Empezamos
comments
con
in the
la
chat
mano
box.
de Richard. Richard, por
Richard,
favor.
can you open your microphone?
Audio y el visual.
Hi,
Aquí estoy.
here I am.
Sí.
Ok. Bueno, sí, en América Latina tenemos una
Well,
situación
in Latin
de
America, we're facing a
baja
situation with regards
disponibilidad
of the low availability of
como parte
PrEP
de prevención
as part of the
combinado
prevention
en la
activities
región.
combined
Solo
in
hay
the region. There's
4%
only
de las
1-4%
poblaciones
of the population
poblaciones claves que tienen
of key
acceso
population that have access to
en la
PrEP
región,
in
salvo
the region,
Brasil, tiene
with the
un
exception
poco
of
más.
Brazil, that they may have a
Al
more.
principio,
The
la PrEP
question is,
representa un
at the
costo
beginning,
adicional
PrEP represents an
en el
additional
primer
cost,
año, segundo
maybe
año, pero no
throughout the
no
first or
vamos a
the
ver
second year, but that doesn't
en
mean that
4,
later on,
5,
after
6
3,
años
4, 5 or 6
el
years,
costo va a ser
that we will
más
see
bajo
that the
porque no
cost will
vamos a
be
estar
lower because we
tratando
won't be
personas que viven con
treating
VIH,
people who live with
pero
HIV, but we are still
más
with
o
PrEP,
menos por el Fondo Estratégico de
which
Pago es
from the
50
strategical fund
por año
is
más el
$50 per year, plus
adicional.
some other additional
Es un
tests also.
comentario
So this
pregunta.
is just a common question.
Gracias, muchas gracias, Richard. La verdad
Thank
es
you so
que
much, Richard. Yes, it's Joan.
esto no está en discusión. La
For me,
prevención
I'm not
extrema es
discussing
costo
this.
efectiva.
PrEP is extremely
Según
cost
pues,
effective.
todos los
It's
estudios que
extremely
hemos
cost
realizado,
effective.
yo creo que
All
las barreras
studies
para la PrEP no
demonstrate
vienen
that.
por el
I think that
costo
barriers
económico,
for
la
PrEP
verdad,
is not an
porque
economic barrier, but it's a political
es la
barrier.
voluntad política de los
That's the political
países
will of those
ofrecerlo
countries
o no
on offering or
a
not
las personas
to
que lo
those
necesitan. Luego
who need
podemos
it.
discutir cuál es el mejor modelo,
We can
incluso
discuss
para
which is
incentivar
the
la
best
demanda,
model in order
y a mí
to
me interesa
incentivize
promocionar
is
mucho la PrEP a
to
nivel
promote
económico de los
the PrEP from the
en muchos
vendors.
países la gente no conoce la
In
PrEP,
many
está muy lejos
countries,
para
they don't know about PrEP,
se la expliques así
but
a
even though
gente
if
que
you
está
explain to
inquieto, que no acaba
them
de
in a
entender
project,
y tiene miedo a
it
los
is not
efectos
easy for them
secundarios.
to understand because they are
Las
afraid
grandes
of
dosis,
these
por ejemplo, no conocen bien su interacción
secondary effects. They don't know
con
the
los niños,
interaction with the hormones, for
pero sin
example,
embargo,
for
pues,
trans
de
population.
alguna
But
manera
if
generalizar la
if
evaluación
we
de
would
riesgos y
like to
seguridad y
generalize the
identificar
risk
pues, que la
assessment,
persona está en
once that
riesgo
we
de
identify that
sufrir
the person
por
is
su lado,
following
es un
risk
proceso muy
practices,
específico
we
que
can tell them, no, we have asked you some questions, and in a friendly way, it seems that you are having these
entendido que te iríamos
risk
guiando
practices, and I think it will be useful for you to start
en esos
doing the
contextos,
test
pues
and to
esta es
start
una
using
pregunta
that.
efectiva
So
sobre todo
in those
cuando
concepts, in
se
those
busca
aspects,
controlar
when
el
it is being
sistema de
offered
salud,
from the
pero yo
very
creo
beginning,
que las
either by a
fundaciones
vendor or by the health sector,
empezarán a ver la PrEP de otro
people
modo,
then will start looking at
como un
PrEP in a
servicio que
different
está
way as a
ajustado
service that it's been
y
adjusted
eso
to
también
needs.
llevará
And
a
also
que haya más
that will
demanda y
take
por tanto haya
that
más
will mean that there will
presión
be more
para hacer
demand
uso
and of
de la
course
PrEP.
more pressure. So countries then offer the PrEP.
Gracias.
Thank you, says Richard.
Gracias, Richard. Gracias,
Thank
Joan.
you, Richard. Thank you, Joan.
No hay más comentarios en el chat, pero
There's no
tengo
more
otra mano
comments in the
levantada.
chat box, but I see
¿Se
that there
escucha?
is a hand raise. Lidice.
Hola, Joan. Muchísimas gracias
Hi, Joan. Thank you so
por
much.
esta presentación
Thank you so
realmente
much for
muy,
this
muy
presentation.
ilustrativa
Very
y como para
illustrative.
avanzar en el análisis
And
de cada
just to
uno de
move
nuestros
forward
países,
within these advances in each one of our countries, how we can move forward, how can we measure?
la pregunta que quería
And
hacerte,
the first question that I
¿qué
wanted to
señales
ask
de
you is,
alerta
what
tendrían
are
que
these
identificar para
alarm or
tener
these
ese
warning signs
agotamiento
that
del
we
modelo
to
en
measure
curso, ¿no? ¿En
this
qué momento
exhaustion of the model that we are
debemos empezar a
implementing
buscar
right
otros
now?
modelos?
what is that point that we need to
enseñar
consider?
realmente
Where
los
is this
efectos
warning alert or
y
sign
la
that we
segunda
need to
tiene que ver
consider so we
con
can
si
consider
hay
moving or
experiencias o modelos
complementing with another
alternativos
model?
que hayas
And the
visto
second question is, are
que
there some other
podrían
models,
aplicarse
alternative
para
models that are
mejorar
being
en
implemented
otros
in Latin
países
America, not only in Latin
que
America, but also in
rompen
other
con lo
countries
tradicional
that break with that
en México está el VIH
tradition on
podrían
the
ser
traditional
alternativas
models
para
for
alimentar
HIV that will be
nuestros
useful also
bebés
to
y buscar
continue
otras alternativas para
feeding
minimizar
these
esas brechas que cada vez son más
innovations
difíciles
so we can reduce those gaps
de cerrar.
that that
Gracias
with
por
the time go it is
Muchas
difficult to
gracias por
close.
las dos preguntas.
Thank you so much for your
Sobre
questions.
la primera, yo creo
By
que
answering to your first question, I
importante
can say, says Joan,
es que la
that the
sociedad
important thing here is that
tenga
civil
muy claro cuáles
society has to
son
have
nuestras
clear
metas,
what is
nuestros
the
objetivos.
output
Hasta
that or
ahora,
the outcome that they are looking
nosotros
for
nos
in
habíamos
health matters.
centrado en
As of
saber
now,
si
we
estábamos
were just
cumpliendo
centered on knowing that we were complying
nuestro rol a
with
partir de
our
los
role
indicadores del Fondo Mundial.
based on the indicators of the Global Fund.
Creo que es un momento en que
I think that now it's the moment, it is important for us to see
nosotros como
we
subsectores
as
del Fondo
sub
Mundial, por un lado, que tiene sus indicadores,
receivers,
incluyendo
on the
indicadores
one
de
hand, we
cobertura,
have
y por
the
otro lado,
indicators of the Global Fund,
nosotros como
coverage
sociedad
indicators, but also
queremos
we as social
mejor
as
salud
civil
para nuestra
society,
comunidad.
we want a better health for our communities. So we need to identify those indicators for our own. And those indicators will let us know if
Lo que estamos haciendo nos está dando lo que queremos.
whatever we are
Eso
doing
por
is
un lado.
giving us
Por
what
otro
we
lado,
want. That on one
ser
hand.
proactivos
And on the other
en
one, we need to be
identificar esas
proactive on
alertas.
identifying those warnings.
No es suficiente con decir,
It is
bueno,
not
el
enough
Fondo
to
Mundial me
say
pidió
the
90%
Global Fund is asking me to have this 90% of coverage
pruebas
with regards
de
on the testings on the
lo
HIV
conseguimos.
tests,
O sea,
and I have been able to reach that, and there is I comply with my role. No, but what is the objective behind doing the test? The objective behind that is to find those cases, those positive cases, and make that linkage between the health sector. And if I'm able to find them or not, and if I'm not able to find them, why is it that I'm not able to get them? So we need to avoid this defensive attitude. We need to avoid that. Like, I've been assigned these geographical areas with low prevalence, or because they haven't allowed me, or because the test didn't arrive on time. Yes, I know that happens. That is our reality. But we need to try to be less defensive, less victimism, and more proactive. What are the other interventions? What are the other models? Or what are the other strategies that I might think on, or that are being proven in other countries? Or who can I ask? So I can reach that population that is missing. So in that sense, the OPS, World Health Organization, the Pan American Health Organization discusses the generalization of the risk assessment. And I know that this is a very complex topic because they ask questions, they raise questions that are confidential to those people in specific contexts, and we might say that they are not so friendly. And I know that it has to be done from, but this assessment about, allow us not only to offer PrEP to the person that is in front of us and that we see that they are practicing, that they are having risk practices, but we can ask them also, can you give me the contact of the persons, of the people that you are having sex with? And that we can do that with a person that tests positive, because if that person is at risk, is being negative, what we want to do is to retain them with a system to offer PrEP, and if they don't want to use PrEP, then to be there to accompany them and to try to reach their contact list. So we can offer also those tests to that list of contacts, because that person is not having the risk by himself or by herself. They're just having that risk together with someone else. So if they don't want to, we can also say, well, take these self-tests for you to share at the place where you want, so then they can also have access to the tests. So all those strategies are under discussion, and from my point of view, these are just incipient experiences, but I think that we need to start. We need to start testing them, to start trying them. I'm not saying that these are the ideas, but are good ideas also. And then we also need to test and we need to have data to
Y
see
si
if they work or
funcionan, se
not. And if they
amplifican
work,
hasta que se
we can
agoten.
expand them until we exhaust
Y
them, and
cuando
then
se
we
agoten, hay que
continue.
pensar en
Once that
cambio.
they are exhausted, we need to think on different things, on new things again.
Gracias, Lee.
Thank
Preguntas
you.
muy interesantes, la verdad.
Very interesting
Quisiera
questions in the
darle
chat
tiempo
box.
para
We
unas
have
dos
time
intervenciones más.
for two
Veo
more
que Javier tiene
questions.
la mano levantada y tenemos un comentario en el chat. Pero quiero darle
I
paso
see
a
that
nuestro
Javier raised his hand.
Gracias,
Open your
gracias,
microphone.
Joan.
Thank you so much, Karen. Thank you, Joan. As it happens in Peru, it's always refreshing to see an analysis completely different with regards of the investment and costs and everything, just not to insisting on those who are cost benefits. So the questions that we do, this is not the objective. Which is the model? Which is the tool? Which is the model that works? We're looking at the countries of all around the world, not only those from Latin America, that they have this concentrated pandemics that 30 to 35% of those who can be benefited from the test, from the models, and from we don't reach them. The highest fruit of the tree of digital access, of course, if we were able to reach that 90-95%, the cost and the investments of those interventions will be lower, of course, not only for that scale, but also because we will have better coverage or we will have better margin. Obviously, the question is not for you, but the question is for for all of us that we participate in these discussion sessions. We need to find that model. We are still printing flyers at four colors and doing these peer outreach. So I just want to share. I'm not asking you to give us the model, because if that, then you will be kidnapped from Latin America to solve all these issues. But it is important to understand that the Global Fund invests and will invest what you ask for, as long as whatever you are asking is based in evidence. What is being shown today, if one country has the model and it has this economic analysis, and that's why I think that this work is important. The only revision panel will say, yes, if you say, for example, with these interventions and with these activities, I'm able to reach maybe not that 100%, but the 85% of MSM, then the Global Fund will pay for that. The problem is that we're still showing the same models, we're still showing the flyers to reach the peer. And then the PrEP, this position, it is a lack of political will from the governments, but also in order to speak about combined prevention, not only offer that which costs $4 to $6, but also the state needs to give syphilis, HIV, of course, but you cannot give PrEP if you don't do a quick test. Another sexual health interventions for MSM and also for trans population. So in that case, the government will show this counterpart with, let's say, the clinic, and then they offer, as it is done in Europe or in the US, the USA, they offer sexual health services. So these are two different comments, and it is not a question, because if you were having the model, you will be
Gracias,
kidnapped.
Javier. Pero
Thank you so
tengo
much,
que
Javier,
decir
says
algo.
Joan, but I still have an answer. I have a comment
Tenemos que dejar de
to your
pensar
comment.
cuál es el modelo.
Let's stop
La
thinking on
pregunta
which is
ya
the
no es
model.
cuál.
I think that
Creo
this
que la
question is
pregunta
not
es
relevant. The
cuál
issue
es
here is
usa. Ya no
what
hay un modelo.
it is not
Ahora
a
lo que
model, it is
necesitamos
not one model. What we need is like a
es un
toolbox.
proceso
We need a
constante
toolbox that
de
has
discusión,
to be under discussion,
constante
under
innovación,
constant discussion and
en el cual
innovation,
vamos probando cosas.
where we are testing things.
Y algunas de esas cosas
And some of these things
pensamos que van a
might
funcionar
work, but we know that at a certain point they
lo
will
mismo
not
que la
be
misión
useful anymore.
Ares ha funcionado
So also
para
this
Malaria.
peers outreach
Ha funcionado y ha dejado
has been useful, and at certain
y
points it
tenemos
just stopped working.
nuevo
So when we try
A, B,
this
C
new
de modelos.
ABC model,
Uno de ellos puede funcionar,
some of
otro
them
no.
might work, but also it will expire. So what we need is a focus. We need an approach. And what I'm proposing is that let's have an approach being guided by the evidences. Let's do the test, try, let's test. And of course, sometimes we don't have evidence because it is the first that it's used, but if we give the arguments that can be piloted, And if
funciona,
we
según
test
nuestra
that,
capacidad.
if we demonstrate that it works, we can scale up. But let's not
Cuando
sleep.
escalemos,
Let's not be inactive.
porque
Once that we reach that level, we can move on.
de nuevo
And therefore, we need to find another innovative model or another
hasta el
way
punto
to
en
do
que
things.
simplemente diremos,
Until there, we will reach a point
esto es
where we
70
will say that
pero
this
claro,
is
ese techo
the
no puede ser
ceiling of that model. But that ceiling can
solo el
be
95.
70. It has to be the 95 as minimum.
Eso es
So
lo que propongo.
that's what I'm proposing here.
La respuesta fácil es, sustituye este
The
modelo por
easy answer is let's replace this from this model. No, that's not the answer. The complicated answer is that now, as of now, in an ongoing basis, we need to keep on discussing the models, and that has to be guided by data and by evidence.
Gracias, Javier. Gracias, Joan.
Thank you,
Sé
Javier.
que
Thank you,
ya
Joanne.
hemos pasado 3
I know
minutos,
that
pero
we don't have
hay algo
more time,
que
but
tenemos en el chat de Susi.
the chat box, we have a comment from Susie from Pasmo,
De que
and
en
she
Pasmo
speaks
están
about that in
implementando
Pasmo
esas digital
they are
strategies
implementing a digital strategies
completas.
centering the user
Justamente innovación
on
estamos
a
buscando
long-term
aplicaciones
journey,
eficaz.
including innovative
Y también
components
compartir la
that are
experiencia de
having
implementación de
effective results
estrategias
on
ciberofensivas.
identifying new cases. So
Perfilación de
kindly,
riesgos,
they will share
detección
this
y
experience on the
prevención,
implementation of the strategies on cyber education and profile risk and
Em,
segmentation, and
ahora
also
le voy a
include
dar la palabra a
the
Joan,
strategies with the
pero
private sector.
me
We'll give the
parece
floor
muy
to
interesante
Joan,
toda esta
Karen,
reflexión
but
porque
I had
no es
all
la
of
primera
the
vez que se habla
reflections.
del tema, pero
It's
tampoco es la
not
última
the
vez que
first
vamos
time
a
that
hablar
we
sobre esta
discussed about it, and it won't be the last, of course,
eficacia.
that we speak about
Hemos
this
llegado de
strategy,
pasos en pasos, algunas veces pequeños,
moving
otros
step by
grandes, pero
step,
logramos
sometimes
definir una
small
estrategia
steps and
integral.
sometimes big
No
steps.
hay
So
un
it's not
método
that
de paso
there's
a
not
paso a
a
seguir. Hay
perfect
todo un
strategy.
contexto
There's not a
socioeconómico en los
step-by-step model.
países.
All the processes are different in all the
Algunas veces
countries,
se
and
puede
in a
equivocar.
way, this is just like a
También quiero recalcar la
failed
importancia
trial
de las
effect.
investigaciones
And
dirigidas
it
por la
is
comunidad
important
para
also
crear
to
estas
recall
estrategias
these interventions
hechas para nosotros las
from the
organizaciones,
strategies
para
developed
trabajar
by
en
organizations.
nuestros
So we
propios
can work
recursos
within
y
our own
tiempos.
resources and our own
Em,
timings.
yo solo quiero dar la palabra de
I just
nuevamente
want to
a
give the
Joan
floor
para
again to
últimas
Joan
reflexiones, últimos
with
comentarios.
these
Vi que el
reflections.
jueves que pusiste su correo en el
I
chat,
saw
si
that you
alguien
wrote
quiere
your
contactarte.
email in the chat box just in case someone wants to contact you.
Joan.
Perdón, estaba diciendo a la siguiente reunión que tenía que llegaba tarde. Bueno, esto es una discusión que tiene que ser
Well,
continuada.
yes, this is an ongoing
Una
discussion
de
from my
las
point
cosas
of
es que
view.
para que esto
One of the
funcione
things that
tenemos que
for
poder
this to
más
work,
en
we need
análisis.
to be trained
De
on
acuerdo.
data
No
analysis.
vamos a poder determinar si
Won't be
nuestros
able to
servicios
determine if our
van a
services
funcionar
work properly if we don't know how to translate
necesitamos hacer unos
data
estudios
collection. And we also
adecuados
need to
para que eso sea. Por
design
supuesto que la
plans
parte
based
de
on
los
that
comentarios
information.
es muy
So
interesante.
this
Seguramente podemos
explanation is
coordinar
truly
que se
interesting. We
continúe.
can organize another webinar,
Yo no diría
but I
eso.
think that
Ahora
I will say that
la
what it's
estrategia de
been
cyber
offered or the
gestionar
cyber
esto tiene
strategy
que estar, no,
is what we need to do. No, no,
tenemos que ir
no.
hacia
So
una actitud en la cual los
we
modelos
need to
están
follow
basados
a
de los resultados que
model.
estamos
The
obteniendo.
models are based on the results that we are having, and those,
Y si no están funcionando o
and
empiezan a
if they are
fallar,
not working, and if they are being exhausted and they are getting this fatigue effect, we need to see what is the
¿de
next that
acuerdo?
can be done.
Entonces,
So
yo estoy muy agradecido por esta oportunidad
I'm so
y
grateful. Hopefully we can move on and we can continue having these discussions in the near future.
Gracias, Joan. Gracias
Thank you so much, Joan
por
Seskeren.
hacer y trabajar con
Thank you
nosotros en
so
este
much
webinario y
for
también
doing
a los
and
demás
for
por sus
organizing, for
reflexiones
participating in this
sobre
webinar and for your reflections on this
bueno,
topic.
he
So
dejado
I
en el chat
just left in the chat box the
para
links
el documento
for you to see
sobre
the
prioridad
document
estratégico y también la
on this
presentación
prioritization and
hoy.
strategic cost
También
that we saw
esta
today.
grabación va a estar en la página
Also,
web
this
de la plataforma por si la quieren
session
revisar.
is recorded and
Esto no
will be
toma más
uploaded
que
in the
media
LAC
hora.
platform
Va a ir
website. This discussion
pueden
doesn't finish
seguir aquí
today.
revisando y
It
también
is an
pueden
ongoing
conocer
discussion and it will be
estrategias
updated and we
aplicadas
can note strategies
en
of
los
all
últimos
other
meses
countries.
por
Thank you so
medio del
much.
webinar de la
Thank you so
plataforma.
much for joining
Espero que
this
tengan
webinar.
un muy
Hope
lindo
I
día
hope
y
you
un
have
feliz
a
domingo.
nice day and a
muchas
very
gracias.